Hello, and welcome to the Supportive Care Services Live Lunch and Learn series. My name is Vansell Hunter, Marketing Specialist with Ironwood Cancer and Research Centers. The Supportive Care Services Department has created a series of live lunch and learn videos to help you be successful when navigating your cancer journey. They are here to help you get actively involved in your healing process. For more information about the Supportive Care Services Department, please email socialwork@ironwoodcrc.com. Today's featured speaker is Medical Director of the Supportive Care Services Department, Dr. Heidi Rula. Her discussion topic for today is Survivorship, a prescription for restoring health in the cancer survivor. Let's all welcome Dr. Rula.
Welcome, everyone. Thank you for joining us for this first talk in our Integrative Approach to Cancer Survivorship series. I'm excited to launch the series with this first talk on a prescription for restoring health in the cancer survivor. We have a series that consists of 4 talks. Following my talk, we are going to have a talk by our social work department, Nicole McAllister, on survivorship, taking care of you. Our third talk will be from our dietitian team here at Ironwood. Kara Bieber and Kendra Peterson will be discussing eating like a survivor, Mediterranean and a plant-based diet. And then we're going to close out the series with exercise basics for survivors. And this is by Kathy Costin, an RN with some expertise in exercise for the cancer patient. So we're excited to really get this series launched. For our patients, we find that the survivorship phase is often a time when patients feel a little lost about what they can be doing to help restore their health and what steps they can take to be the best caretaker of their body to help lower the risk of cancer returning. This is really why we put together this series, to give cancer survivors a template for really kind of creating some lifestyle measures that they can take, not only to decrease that risk of cancer recurrence, but also to improve their overall quality of life. I'm the Integrative Oncologist here at Ironwood Cancer Centers. Many people are unfamiliar with what the field of Integrative Oncology is all about. My role here is really to support patients throughout their cancer journey, from diagnosis well and into survivorship. And in Integrative Oncology, we really look to provide that holistic kind of healing-oriented care for patients, where we take into account all aspects of lifestyle and pull in other evidence-based healing systems like naturopathic, homeopathic, and in traditional Chinese medicine, in addition to conventional therapies to support them through their cancer journey. Now, again, I think Integrative Oncology is very well suited to really work with the cancer survivor in creating a survivorship plan to move forward, to really look at lowering that risk. Many patients ask, what is a cancer survivor? When am I considered to be a survivor? Well, a cancer survivor is actually anyone who has been diagnosed with cancer from the time of diagnosis to the end of life. But for clinical purposes, to help to really coordinate care, it's best to really divide survivorship into phases. Phase 1 is considered to be the acute survivorship phase, and this goes from the time a person is diagnosed to the completion of their treatment. Phase 2 is the extended survivorship phase, and this is really when treatment is completed into the months after, where we are focusing on the effects of cancer treatment and kind of restoration of health. And then phase 3 is really in that permanent survivorship, where we are quite a ways off from the diagnosis and treatment, and that risk of cancer recurrence is quite low. So for the purpose, of our talk, we really are focused in on that extended survivorship phase, which is a phase that really can benefit from a lot of support. So many patients really enter that phase with a question, what now, what next? It can be a phase where all of a sudden, a lot of the cancer treatments and your connection with your cancer treatment providers starts to really thin out, and now you have a lot more quiet, a lot more room in your life to start to think and contemplate about all that has happened and what this diagnosis means to you. And sometimes patients are quite taken by surprise as to the emotions that they feel during this phase. Now, everybody has a unique experience when they go through cancer, so everybody may experience quite different emotions. No two people are going to enter this in the same place. But what we hear commonly from patients is that they thought that this would be a place of joy and relief, and many times it is, but it also can be accompanied by a whole host of other emotions. I think one of the biggest ones we hear is anxiety about fear of recurrence, that many times while you're in active treatment and having regular touch with your healthcare team, that gives you a sense of comfort that you're working actively to address this cancer. But as you start to disconnect a little bit from your healthcare team, sometimes some anxiety can come around whether or not this cancer is recurring, and what these different symptoms might be coming on in that you're experiencing, and whether or not that's a sign of recurrence. So lots of anxiety can really enter this phase, as well as really starting to look at your life. Sometimes a lot of things can have changed from the time you're diagnosed to the time you're done with treatment, whether it be work issues, relationship issues, just how your body is feeling. Sometimes, again, lots of different things that can happen to the body as it's going through cancer treatment, and worried about what the future may hold, what your health may be moving into the future. So this phase, kind of entering into this extended treatment, this extended survivorship phase, can be one where really connecting with support can help you navigate some of the emotions that come up. And this is really how this talk and our series of talks can help the cancer survivor, as well as, again, we have a host of other supportive services here, especially our support groups. Our cancer survivor support groups can really help people connect with peers to understand how others are navigating this, and this can be incredibly beneficial to help you navigate your own personal experience. When we put together this series, we really felt that lifestyle was such an incredibly important part of how we get the cancer survivor into healing and into kind of going into that place of wellness, because lifestyle has been shown to be so impactful on health and healing, and it plays a role in whether or not a person is at risk for cancer and what their risk for cancer recurrence will be. When we look at some of the literature, we see that about 35% of cancers out there are related to a poor diet. About 30% of cancers are related to the use of tobacco, 20% related to obesity. And then there's other factors like chemical exposures, the use of alcohol, sedentary lifestyle, and chronic inflammation that also can be contributors to the risk of developing cancer and the risk of cancer recurrence. So for our prescription for wellness, we really want to look kind of at some of these elements of lifestyle and how you can start making some changes to be on the track to wellness. Our first step in restoring health is through nutrition. Nutrition really is the foundation for health. It is the place where our body gets the nutrients it needs to detoxify, for our cells to function optimally. And so what we put in our body is incredibly important. Some little facts that we have shown, some of these dietary links to cancer, we find that there's a link between sugar and cancer risk and risk of dying from cancer. So high sugar risk can increase it can increase the risk of prostate cancer. We look at these carbohydrates. We know that the American diet is very heavy in carbohydrates, a lot of processed foods. And we see that postmenopausal breast cancer patients who don't reduce their carbohydrate intake have a greater risk of recurrence than those who do. So again, some of these things like sugar and carbs may be connected again to kind of your cancer prognosis. We also know that there's certain foods out there that have some direct links to cancer risk. Those being like processed meats, red meat, alcohol, and dairy use. And so again, nutrition can very much tie into your risk of cancer recurrence. So what should I eat is a big question that we hear over and over again. And I think, the preponderance of evidence is really that a plant-based whole foods diet, which is really kind of following that Mediterranean type diet, is where we have the strongest data showing that we can make a difference in survivorship. Especially increasing a lot of your colorful fruits and vegetables, having at least 5 to 9 servings a day. The fruit and vegetable intake we see over and over again on studies that is very impactful in survivorship. Also trying to increase the fiber in your diet, trying to get about 30 to 50 grams of fiber, and sometimes that means taking extra fiber supplement to kind of help increase fiber. But fiber actually helps with kind of our digestion, it helps with detoxification, it helps the way we absorb, different nutrients, and it can help with this microbiome, these beneficial bacteria that are in our digestive tract. Fiber serves as kind of a prebiotic or a fuel source to kind of help these communities stay healthy. So fiber is very important in the diet. We like to incorporate superfoods when possible. Pomegranate, the deep red pigments of pomegranate, loaded with polyphenols. These are chemical compounds that act as antioxidants in the body and help clean up our cells. And things like fatty fish, berries, cruciferous vegetables like broccoli, and whole soy products, what we put in that superfood category. Fats, the type of fat we eat has also been linked to different cancer risks, and so really want to focus on trying to get more healthy fats in the diet. So olive oil, avocados, nuts, seeds, fatty fish, and really kind of minimizing the saturated fat. So that animal fat coming from like red meat and dairy, so dairy, so think about butter, cream, cheeses, all of these are dairy fats that have a lot of saturated fat. So it's not that you can't have any of them, but we really try to keep those on a minimal side of the diet and really focus on getting more of your fat intake with the healthy fats. Talked a little bit about sugar, but we know that a lot of processed sugar is not good for our health and not good for cancer risk and for the cancer survivor. So really kind of keeping that as a small budget in your daily intake, and focusing on whole grains, unprocessed. So things like brown rice, quinoa, steel cut oats, minimizing things out of white flour. Even wheat flour. So anything made out of flour, again, can really kind of tie more into these high carbs. So it's something that you want to keep a little on the lower side and focus more on these unprocessed grains. So we are going to be doing a deep dive again with our dietitian talk that we have upcoming. So that will really kind of give you some more information on how to eat like a cancer survivor. Step 2 for restoring health is through movement. Movement is incredibly important. We see that over and over in all different aspects of health, and cancer survivorship included. It's one of the most impactful things that we can do for the breast cancer or any cancer survivor. We see that breast cancer and prostate cancer patients who are physically active have a lower risk of being diagnosed and of dying from cancer. So really activity can be incredibly important. And we see that when a person incorporates healthy diet with physical activity, that these two in combination have an additive impact. And we see up to a 60% improvement in survival rates with different cancers. So significant impact by just focusing on nutrition and movement. How much? Well, again, we're going to be having a whole talk on exercise, but I just wanted to highlight some of the data. What we're seeing, that if you can get about 30 minutes of physical activity a day, now that's not a lot. Can you find 30 minutes in your day? And it can be gentle walking, it can be yoga. Again, any type of movement has been shown to be beneficial for the cancer survivor. But what we do see is that if you're able to do more of this high intensity exercise, something that really gets your heart rate up, gets you sweating, especially in this interval pattern where you can do a pulsatile push of your intensity, maybe go through a few minutes where you get your heart rate up and you're sweating, and then kind of back off and do kind of a walk or something that will allow your heart rate return back to normal, and do that in a few minutes on, a few minutes off. That type of interval training, what we call HIIT training, has been shown to have even greater benefit for the cancer survivor. The next step is really looking at weight. So weight is something that is, or we talked about in the beginning, that being overweight or being obese, can contribute up to 20% of cancers. And we see some data in the cancer recurrence literature as well. So certainly step 1 and step 2 can really tie in to helping people achieve step 3, which is getting to that healthy body weight. We find that achieving a healthy weight after cancer can be very difficult. Breast cancer patients have shown that up to 2/3 of women are going to gain significant weight after their cancer diagnosis. But on this other side, we see that if you gain that weight, your prognosis is poorer than if you're able to at least maintain the weight that you are going into your diagnosis. So incredible importance about putting some emphasis on weight, and at least not gaining weight after that cancer diagnosis. Step 4 is really looking about toxins. We live in an incredibly toxic world where there are toxins everywhere, from the air that we breathe, to the water that we drink, to the foods that we eat, to the containers that our foods are packaged in. Again, we see it for the things that we put on our skin, to the products that we use to clean our house or to do gardening, or things different chemicals that we use in our workplace. We are constantly inundated with hundreds and hundreds of chemicals every day. Many of these are unstudied in human health. And so it really becomes a personal responsibility to try to understand what are the toxic exposures that you are facing every day. It is not possible to kind of be toxin free in terms of what your toxic burden or how many toxins you're being exposed to on a daily basis, but it is possible to slightly lower that burden that you're being exposed to. One of the biggest things we see in terms of cancer risk is tobacco products and secondhand smoke, and so really trying to look at that and see, making that a priority in health. That can be the most important thing you do for your health if you are a person that smokes or uses tobacco products, or live in a home or in a workplace where there's secondhand smoke. We talked a little bit that our food sometimes can contain some of these chemicals in there. And so if possible, we try to get our patients to eat organic. But we find that really the emphasis should be on just eating fruits and vegetables. And if, buying organic is not what, in your budget, it's still important to eat them even if they're not organic. So we don't want to dissuade you from eating, non-organic fruits and vegetables. But if you have the ability to purchase the organic version, obviously that's another way we can help you lower your toxic burden. I think water is incredibly important. We should be drinking large amounts of water every day, and we see that our water supply is not always delivering safe, clean water. If you look at the issues that Flint, Michigan had with all their water supply and people getting sick from the toxins that were in that water, really becomes important to think about where you're getting your water from. And one thing that I find patients are doing is sometimes they're trying to do they're getting all of their water as bottled water because they're worried about, the toxicity of the water from their tap, or they don't like the taste of it. So they'll buy cases of bottled water, and that'll be their only water source. But what we're seeing, in these studies on the water coming from this bottled water, that it actually, a lot of these plastics, the chemicals from plastics, are leaching into the water. So if you're drinking that all day long, you're getting exposed to plastic all day long, which again can accumulate. Occasional use, occasional drinking from, bottled water, fine, but you really don't want that to be your main source of water. If you can get some type of filtration system in your home, or you can get the big jugs that you are refillable at some of these filtration centers. But really kind of looking at where your water comes from is a big way that you can have an impact on kind of the toxins that you're exposed to. Again, we are putting many different products, especially women, use hundreds of chemicals on their body every day, from the makeups to the lotions and other different care products, deodorants, and then also, the things that we use in our house. Lots of chemicals are being used to clean, sanitize, especially right now in the time, of COVID. We're seeing people trying to, use lots of bleaches and things, and lots of exposures to some of these chemicals. And you're really kind of looking at the safety of them. A great resource that I am continuously referring my patients to is the website ewg.org. This is the Environmental Working Group. It's a consumer advocacy group that really gives you information about many different products that the consumer is using, from, again, these personal care products. They have a app that you can download for your phone. I believe it's called Skin Deep, and you can scan barcodes of some of these care products in the store and find out if there's any worrisome chemicals in that product, and find ones that are generally going to be a little cleaner, a little using less kind of toxic chemicals. So that can be a great resource. They also have different lists about produce in terms of how to guide that, seafood use. So it's a great site that I encourage you to go and explore. It is completely free. So a great place for consumers to get informed. The next step is really about stress. How do we restore health? It's really by creating some resiliency to this constant stress that is part of everyday life. Again, there's no way to live in a bubble of that where your stress doesn't become part of your day-to-day life. And so really it's about developing tools to help you be able to manage the stress. We don't think that stress is a cause of cancer. We don't have any, studies to really support that, but we do see that in some studies that being under high stress can play a role in cancer progression. So it can impact the course of your cancer care and your post-cancer treatment. So, looking at ways to kind of get yourself out of this high stress mode can be a way to impact health. And we see, just different activities like meditation have been shown to lower our stress hormone levels and improve our immune function. And these are all important ways to impact health in the cancer survivor. Some ways to really develop resiliency is to really find a daily relaxation practice that works for you. Not everybody wants to meditate. Not everybody wants to do yoga. But what type of activity can you do on a daily basis that is going to help kind of reset your stress level, to bring it down so that, again, you're not staying in this chronic high cortisol, high stress hormone state that is impacting your health. Mindfulness practice, heart math is one that I like for patients who really like a little bit of information about how they're doing. Sometimes people don't even notice that they're in a stress state. So heart math uses a little biofeedback, so it gives you some tools through measuring heart rate variability, so that you can see whether or not you're in a high stress state, and also as part of the program teaches you some relaxation techniques weeks, so that you can continually kind of reset that stress and get yourself out of that high stress state. Another way to really kind of restore health is through sleep. Sleep is critical. Many studies on the role of sleep in our health, and so certainly it's an area where many Americans struggle. There's a large percentage of people who don't get the recommended 7 to 8 hours of sleep, which has been found to be the optimal amount of sleep for an individual. Very few people do well long term, getting less than 7-8 hours. But it is an area where we commonly see cancer survivors struggle. They've shown that up to 40% of cancer survivors who are up to 5 years out and report issues with their sleep. So it's an area where a lot of times there can be some need to really kind of get resources and maybe look at developing some new patterns to help improve sleep and kind of reset that sleep clock in your brain, that circadian rhythm that we have that dictates our wakefulness and our sleepiness. And so some of these long-term sleep disruptions have been shown to be a direct link to increasing cancer. So anyway, sleep is something that we want to prioritize. And some of the ways to really improve sleep are to kind of look at some of our sleep patterns. Going to bed at the same time every night and waking up at the same time is one way to really help reinforce that circadian rhythm in our brain. And again, sometimes it's just a matter of making it a priority. Some people, again, are busy 24/7 lives. We have so many things to do that we start cutting into our sleep hours to get them accomplished. But when we do that, we find that people are sacrificing their health. And so it's really important to find ways to protect those hours of sleep. Whether you have to set yourself little reminders or alarms to when you kind of turn everything off, so you don't start really cutting into the sleep hours in your day-to-day. Electronics can be one of the reasons why people are cutting into those sleep hours. People watching binge watching on Netflix, or just staying up late on their computers, or doing social media, or listening to the news. Again, those things can be interrupters for our sleep, especially the light from any type of screen can be stimulating wakefulness in our brain. So really kind of cutting those off at least an hour before you go to bed. Looking at stimulants use, so caffeine can be something that can interrupt sleep. So trying not to have any caffeine after 2 o'clock in the afternoon. And for some people, you might even have to roll that back even a little earlier. You might still have a residual effect for many hours after you consume that beverage or food with caffeine. Even alcohol, I don't have this on the list, but alcohol can disrupt good sleep. It might help you fall asleep, but it doesn't allow you to go through the healthy phases of sleep. So limiting alcohol before bed is another way to do that. And then just a regular relaxation practice, having this consistent pattern where every night you do the same different type of relaxation routine really can help reinforce your brain going from that awake mode to that sleep mode. And the more you do it, the longer you do it, the more powerful it is going to be in helping you make that transition into sleep. Creating kind of an environment that promotes sleep in your room is also important. Dark is the key. Again, making sure that there's no light, that you have dark shades on your windows so that you don't get any kind of street lights or whatever into your room, any alarm clocks or any little glowing lights, night lights you want to have turned off. You want your room to be nice and cold, and have comfortable pillows and mattresses, so that you have the best opportunity to get a good night's rest. And if all of those things don't work, sometimes we'll have patients explore using melatonin. Melatonin is that natural sleep hormone that's released in your brain, in helping make you sleepy as you're going on into the evening. And so sometimes taking a little melatonin supplement again can help facilitate that sleepiness that allows you to go off to sleep a little bit easier or help maintain sleep. So sometimes looking at that doesn't work for everybody, but it might be something to explore if you're still still struggling with getting enough sleep. If those things aren't working, then working with your healthcare team to also look at other ways, whether it be cognitive behavioral therapy or different medications to help you achieve it. But we're seeing, the importance of sleep over and over again in health. And step 7 is really about, healing the spirit. So when we talk about health, we talk about mind, body, spirit. We have to engage all aspects of our being to have total health. And so when we talk about spirit, that means different things to different people. Because for some people, spirituality is their religious faith. For others, it's a connection to a higher power. And for some, it's just the beliefs that give meaning to life. But certainly sometimes some of their spiritual foundations can get rocked with a cancer diagnosis. And so kind of connecting with those things that really kind of reinforce spirit can be helpful, such as prayer and meditation and just reflection and even going out into nature, really kind of connecting you with something greater than yourself can be a way to really facilitate healing. We know that even just kind of being in a place of positive thoughts is important to our overall health. Where our thoughts are shown to affect our biology, and our biology affects our thoughts. So there's a whole field that has evolved called psychoneuroimmunology. And psychoneuroimmunology is just that we can kind of change our physiology with our thoughts. And we really can kind of connect into that with such things as like guided imagery, which is a practice that focuses on engaging all your senses into, kind of this place of healing positive thoughts. Again, these things can impact, our overall health and reduce, anxiety and stress in the body, which again facilitates, cancer survivorship as well as overall cancer health and just quality of life. Some ways to really reinforce positive thinking, and I find that some people struggle after a cancer diagnosis to be in the positive. They've gone through a lot of adversity, and so sometimes it's hard to find the things that they're grateful when their world has been rocked so much. But there are some basic tools that have been found to really kind of bring kind of the brain back into positive thoughts. Again, just sometimes having that intention when you wake up to stay in the positive, setting the tone for positivity, focusing on things that you can be grateful for. Gratitude journaling can be incredibly helpful to really kind of see all the great positive things that are going on in your life. And also, it is really the way you talk to yourself. Focus on talking, positivity, that positive self-talk instead of, being critical and cutting yourself down when things don't go the way. They really kind of focus on, being kind to yourself. Simple things like laughter and humor can change the way our brain interprets the world. So finding things that make you laugh, whether it be reading something funny, watching a funny movie. There's laughter therapy groups where you can get with a group and just focus on laughter. And just surrounding yourself with people who bring that positive into your life, because we know these positive thoughts can really help your body improve health and really lower some of these stress hormones. So that's really kind of the sum of it. The 7 steps to restoring health. So focusing on nutrition, getting some movement in your day, looking at making sure you at least maintain your weight, or even if you need to lose weight, trimming some of your body fat down, looking at kind of the toxic exposures in your day-to-day life, coming up with a way to reduce stress or have a stress reduction practice, focusing on healthy sleep, and healing your spirit. Now, these 7 steps are things that you don't have to do all at once, or you don't have to do major overhauls in any of these categories, but just making some small intentional steps in each of these areas can really start moving you on the way to better health. I think Maya Angelou has said it best for the cancer survivor: my mission in life is not to merely survive, but to thrive. So how can you focus on being a thriver? Here at Ironwood, we have a whole host of different supportive services to help you in this phase of cancer survivorship. Integrative Oncology consultations with myself. We have our social workers are here to help you with coordination of services, both in Ironwood and out in the community. They offer counseling as patients are really kind of adjusting to their diagnosis and all the impact that on their life that their diagnosis may have had. Our dietitian team, offers many different programs to help getting onto healthy diet. They'll have some classes that you can look for in this coming year. In non-COVID times, we'll have acupuncture, lymphatic massage. Right now they're on hold, but many support groups. Again, so important for the cancer survivor to look at connecting with support groups, to identify, with their peers and see how other people are navigating this space of their cancer journey. And lots of classes, things to help with stress like chair yoga, tai chi, meditation, and also educational things on nutrition and wellness. We have our Lunch and Learn series here where we're always, doing a different topic to help, educate you about different cancer-related topics. And then we offer a number of different classes that are patient-led, who have different talents and can be a great resource. So lots of services that are here for you. Make sure to reach out so we can support you in whatever way you need to kind of navigate this next step of your journey. So from there, I'm going to stop the presentation and open it up to questions. Thank you for joining us.
Thank you, Dr. Rula, for that informative presentation. We do have a few questions from our digital audience. The first question is, when does the survivorship period begin?
So as I said, the survivorship period, really, you become a survivor the moment you get the diagnosis. We have the 3 phases of survivorship. And so a lot of times when we're talking about survivorship, we're talking about right at that time, right after you complete active treatment and you're going into kind of working on recovering from a lot of the effects of your cancer treatment. So that's the extended phase and then the permanent phase of survivorship. But really you become a survivor the moment you get that cancer diagnosis.
Wonderful. And the next question, what component of my survivorship is most important? My diet, exercise, or stress reduction?
Well, I like to say that, all aspects of lifestyle are important, but when we look at, what has the strongest evidence of affecting change, I think that, you probably start with nutrition. Nutrition is one of the biggest drivers in cancer risk, and it also can be an important player in cancer recurrence. So, I would definitely, I will start with nutrition, but, but I think, exercise comes in as a close second.
And our final question is, when should I begin these habits to regain normal health again?
I think as soon as you, have come, I guess it depends on how you're feeling. And there isn't, I guess, a one size fits all answer. If you're doing well, during your acute phase and you're in active treatment, but, it's something that's manageable for you and starting to, make some of these changes can be a good time. But sometimes if that first acute phase is overwhelming, then we just wait until the treatment is done and you have a little bit more time to focus on, making some mindful decisions about how to, approach change, for your lifestyle. So.
Thank you, Dr. Rula, and thank you to our digital audience for joining us for the Lunch and Learn presentation, Survivorship, a Prescription in Restoring Health in the Cancer Survivor, featuring Medical Director of Supportive Care Services, Dr. Heidi Rula. We really hope you enjoyed this session. There will be a replay of this Lunch and Learn on the Ironwood YouTube and social media channels. Be sure to join us next week for our second survivorship series, Lunch and Learn, featuring licensed social worker Nicole McAllister. The topic of her discussion will be taking care of you. For more information regarding our supportive care services classes and events, email us at wellness@ironwoodcrc.com. Thank you for spending time with us today.